Hello, my name is Dr. Sienna Miller. I'm a naturopathic physician specializing in functional dermatology, and today I'm going to be answering the question of what is the best diet to follow if you suffer from acne. There's so much information out there these days and varying opinions, so I'm just going to keep it really simple and give my basic tips that I work on with all my patients who come into my office to talk about acne. Just like with any nutrition advice or kind of dietary counseling that I'm giving any of my patients, the biggest thing I like to focus on first is what to add to the diet. With any skin condition, including acne, the best, most important thing to think about and to work on is adding more plants to your diet. Fiber in plants, and especially a variety of different plants, is incredibly beneficial for your gut microbiome and, additionally reflected onto the skin. Fiber also helps with many other conditions, so you really cannot get enough fiber in most cases. So, at every first visit, we're talking about what fiber means and what that includes, and I'm giving fiber goals to all my patients. So by fiber, what I'm really talking about focusing on are vegetables, beans, legumes, nuts, seeds, fruits, herbs, and spices. All the plants fit into that category. The goal daily is 30 grams of fiber per day, and then aiming to get 30 different types of plants in a whole entire week, which sounds pretty daunting, but if you think about it, like all the things that includes, it's not too bad. Like, if, for example, you could make a salad with like 4 to 5 mixed greens, throw some seeds on there, put a couple different vegetables, put some herbs and spices, even pepper counts, and you're already up to like 10 or 15 different things just in one salad. So it's not that daunting if you think about it that way. I really like the Chronometer app. It's a free app that you can use to track fiber, and I love it, at least having people do it for a couple days or a week just to gauge how much they're getting. So that's a big, probably the most important thing that I'm focusing on with all my patients. All those plants and fiber are not only full of nutrients and antioxidants and just good for your skin and your body in general. Another huge benefit of fiber and plants is that it helps to improve your gut health. It lowers inflammation in your gut. It helps to support and feed your gut microbiome and make sure that is abundant. It helps with your gut, mucosal barrier function, all the good things. It is the best thing you can do for your gut health and your skin health is to get more plants and more fiber. So that is the biggest thing that we're focusing on with any skin patient, but also acne. Once I've worked with my patients on what to focus on adding to the diet, we've gone over fiber goals and making sure they're getting enough plants and nutrients in their diet, I do like to counsel people on foods that can promote or push the acne-causing pathways. For most cases, I really don't like to recommend 100% restrictive diets unless it's absolutely necessary. But it's important to counsel patients, and there are foods that we know and evidence has proven that definitely promote the acne-causing pathways. The top 2 foods that I would say contribute mostly to acne and that have the best, most robust research backing them is dairy and sugar, or like high glycemic index foods. If you think about dairy, and I'm not, I eat dairy, I'm not against it. I love cheese and I love my cream in my coffee, but dairy is made for a baby mammal to grow very quickly. So if you think about it, it is increasing insulin-like growth factor and lots of different growth pathways, and in turn that increases skin cell proliferation, inflammation, and sebum production. So dairy, we know, and it's just generally inflammatory for most people in general. So dairy is a big one, and I have seen this a lot clinically as well. It's probably the biggest one I hear about, people saying that dairy makes their acne worse. So I do like to counsel people on it, for sure. The next tied for number 1 is sugar. Again, sugar works via pretty much the same pathway, the insulin, increase in insulin and insulin growth factor, IGF-1, and kind of causing the same pathophysiology that we see with dairy, with the inflammation and sebum production and skin cell proliferation. So those are the top 2. I do often recommend my patients try to limit these things if they can. Sometimes we'll do a trial, like a month or 2, strict elimination, and then bring back one at a time just to see if it really does make a difference. That can be really helpful, knowing that the restriction is just sort of a test to see if it makes a difference or not. I do get a lot of people who come in and say they've cut everything out for months and it doesn't make any difference. So that is the case for a lot of people too, which is why I don't harp on diet too much. It's usually not the end all be all. It can be very helpful, but it's not usually the whole entire story. So in summary, the best thing you can do if you suffer from acne is focusing on adding more plants and fiber to your diet. Just a reminder, you want to get 30 grams of fiber per day and 30 different plants in a week. The next two things are dairy and sugar. Those definitely promote the acne causing pathways for sure. So just something to be aware of. And then just generally an anti-inflammatory diet can be helpful for a lot of people, especially to reduce inflammation in the gut. And that includes like gluten, dairy, sugar, alcohol, processed foods, fast foods, things like that. I hope you found this video helpful. If you did, go ahead and give it a thumbs up. Follow my channel for more videos on integrative dermatology topics. Comment down below what you want to see next, and I'll see you in my next video. Bye.